The smell of betadine never really leaves you. It soaks into the skin beneath the gloves, works its way into the creases of your knuckles, and by the end of a double shift at Foothills Medical Center, it's all you can smell. Even in the parking lot, even at home, even in your sleep, Tara Becker had stopped noticing it years ago. That was how you knew she'd been doing this too long. It was a Wednesday in late February. Calgary in February is its own particular cruelty. The cold doesn't just sit on the skin, it presses through it, through the walls, through the thin polyester of hospital scrubs. The Chinook that had briefly softened the city 2 days earlier was already a memory. Outside the glass doors of the emergency department, the temperature had dropped back to -18, and the wind off the Bow River made it feel like -28. Inside, the ER ran at a slow, miserable simmer, not the sprint of a Friday night, the slow grind of a Wednesday, the kind of shift that wore you down not through disaster, but through sheer accumulation of small awfulness. Tara had 17 minutes left. She knew this with the focused precision of a woman who had spent the last 11 hours on her feet. Her lower back had stopped sending pain signals around hour 8 and had graduated to something closer to white noise, a constant ambient ache that she carried like a second spine. Her left knee, the one she'd blown out jumping from a Griffin helicopter during a field extraction exercise outside Petawawa, had started locking up around noon the way it always did in the cold. She was 34 years old, and some days her body felt 60. She was restocking the suture tray at Bay 2 when the automatic doors at the ambulance bay ground open. The track was worn. Facilities had been promising to fix it for 3 months, and it let out a shriek of metal on metal that cut through the low hum of monitors and the distant argument happening in the waiting room between a man and the triage clerk. Tara looked up out of habit. Combat habit, the kind of reflex you don't unlearn. The man who came through was not a paramedic. He was not a patient. He was carrying something. He was in his late 40s, she guessed, the kind of age that looks older on men who've been outside in bad weather for too many years. His jacket was a surplus Army field coat, olive drab, the kind they stopped issuing a decade ago. He was soaked through, not just the jacket, but the jeans, the boots, leaving a wet trail across the clean floor. He was listing to one side under the weight of what he held, and his arms were shaking, not from cold, from the effort of holding on. What he was carrying was a dog, a German shepherd, large, the kind of animal built like a working machine, all muscle and frame and purpose. The dog's head hung over the man's forearm. Its breathing was labored and visible, chest heaving in shallow, rapid stutters. The white flags of its breath hanging in the cold air that had followed the man through the door. Its left hind leg was catastrophically wrong, the kind of wrong that registers in the gut before the eyes can finish processing it. The fur was matted with dark blood from mid-flank down to the knee. A towel had been wrapped around the leg, a dish towel, the kind with a small maple leaf in the corner, and it had soaked through completely. Help. The man didn't shout it. He said it quietly. The way people say things when they've already been saying them in their head for the entire drive, and their voice has worn the word down to nothing. Please. Tara set down the suture packaging. She crossed the floor in 8 steps. The man's eyes found her scrubs, the badge on her lanyard. He exhaled. His whole body seemed to lose an inch of height with the relief. Sir. She used the voice, the one that landed like a hand on the shoulder, firm and steady and low. What happened? His name was Terrence, he said, and the dog's name was Dex. He wasn't a pet, Terrence said. and his voice caught on the word, not just a pet. Dex had been a police service dog with the RCMP. Had been because Dex had been medically retired 14 months ago after a training incident that left him with partial nerve damage in his right shoulder. He'd been placed with Terrence, his handler of 6 years, through the Retired Service Animal Program. They'd been walking the river pathway when a car had jumped the curb. Black ice, driver overcorrected. Terrence thought it was a Subaru, and Dex had been caught by the passenger side mirror going 40 kilometers an hour. The car hadn't stopped. I took his vest off to look, Terrence said, his voice flat and hollow in the way of a man repeating the same information for the 4th time because he needs to keep saying something. And I couldn't get the bleeding stopped. The emergency vet on 17th is 25 minutes in this traffic. I know it's not. I know I can't. Terrence stopped. Looked at the dog. The leg, he finished. I think the leg's gone. Tara looked at the wound. The dish towel was inadequate and had been from the first moment, but Terrence had applied pressure correctly, and that mattered. The femoral hadn't been hit, she thought, or Dex would already be dead. But the vessel below, the popliteal or a branch of it, was compromised, and the leg was cooling faster than the ambient air could account for. The animal was going into compensatory shock. She could see it in the gum color, white at the margin of the lip where the hair parted. She thought, with perfectly sharp clarity, about the chief of emergency medicine, Dr. Aldous, and his standing policy. She thought about the liability clause in the hospital's operational manual, Section 7.3, which she had been directed to read out loud in front of the department head 2 years ago, after she'd let a family bring in their elderly father's service dog to sit beside him during a procedure because the man had gone catatonic with fear without it. She thought about what had happened after. The written reprimand, the note in her file. She thought about Dex's gum color. Bay 4, Tara said. Move. The charge nurse on duty was a man named Gilles, mid-50s, 22 years in emergency, the kind of nurse who ran the floor better than most attending physicians and knew it. He came around the desk with his reading glasses still on, clipboard tucked under his arm, and stopped cold when he saw what Tara was moving toward Bay 4. Becker. His voice was a warning wrapped in a name. Femoral branch, possible popliteal involvement, she said without stopping. Tourniquets inadequate. Get me trauma scissors, a surgical pack, a liter of Ringer's lactate, and a pressure cuff. You cannot be serious. She looked at him over her shoulder. The look contained everything she didn't have time to say. Gilles said something under his breath in Quebecois French that she chose not to translate. He got the supplies. Bay 4 smelled like antiseptic and cold air and animal when the door swung shut behind them. Terrence laid the dog on the examination table. The paper crinkled sharply under Dex's weight, and the dog let out a sound that wasn't quite a whimper. It was quieter than that, a small, exhausted exhalation of pain that Tara felt in her back teeth. She worked. The years she'd spent as a medical technician with the Canadian Forces before nursing school came back the way physical memory always does. Not thought, just movement. She found the site of highest bleeding by feel before she saw it. She packed with hemostatic gauze, not the towel. She got a pressure cuff on above the knee and inflated it to the correct pressure. Dex growled. Once, a low warning, and then lay still. Terrence had his face pressed into the fur at the back of the dog's neck, murmuring something too quiet to hear. And Tara thought that Dex had gone still not because of the pain, but because of Terrence, because of the smell of him, Because 6 years of field work doesn't disappear with a retirement certificate. Give me his other leg, she said. Front left. I need a vein. She got the IV line in on the second attempt. Started fluids. Watched the monitor she'd clipped to his tongue, improvising a human pulse ox reading animal tissue, but it gave her something to track. The numbers were bad, but they were not getting worse. That was something. Terence said, at some point I was with the Van Dews. The Royal 22nd, Terence Auger. 3 tours. He saved me once. Not dramatically, he added, as if the clarification was important. I'd gone through the ice on a training exercise in January. He tracked me across 400 meters in a whiteout and found me. He just found me. Tara didn't respond. Her hands were busy and her focus was narrow, and she had learned in the forces that sometimes when a person is telling you something important, they don't need you to say anything. They just need to not be alone while they say it. The door opened, not Jill's. The shape in the doorway was wrong. Broader, sharper, with the particular stillness of a person who is not accustomed to waiting for permission. Dr. Aldous stood at the threshold of Bay 4. He was 61, silver-haired, dressed in the charcoal blazer he wore on administrative days. He looked at the dog on the table. He looked at the IV line. He looked at the biohazard waste already accumulating in the bin. His face did the thing it did when he was working very hard to remain calm. "Becker," he said. She didn't look up. "Pressure's stabilizing. I can see what you're doing." "Good." The silence stretched. Then, precisely and quietly, "Step outside." Gilles was in the hallway with his arms crossed. The 2 security guards who'd been summoned were standing at a careful distance, looking at the floor. A small cluster of nurses and 1 resident had formed at the edge of the nursing station, watching with the careful attention of people who are not going to intervene. Tara pulled off her outer gloves. The ones underneath were still clean. She stepped out. The door swung shut behind her. Aldous didn't pace. He stood very still, which was worse. "You have brought an animal, a large animal, unvaccinated records unknown, blood-borne pathogen status unknown, into a sterile treatment bay. You have used hospital supplies. You have used hospital equipment. You have opened this department, and by extension this hospital, to a liability exposure that you clearly have not thought through." "I thought through it," Tara said. "That's even worse. The dog has a popliteal bleed. The tourniquet was insufficient. He had approximately 12 minutes of meaningful perfusion pressure left. There is an emergency vet clinic on 17th Avenue that is 24 minutes from here in current traffic." Tara kept her voice level. She was too tired for defiance. This wasn't defiance. This was just arithmetic. "I made a call. You don't get to make that call." "Someone did." Aldous stared at her. The fury in his face was the precise, contained fury of a man who has built an entire professional life around the correct application of rules, and who has just watched someone treat those rules as optional. "You are on suspension," he said, "effective immediately, pending a formal review with HR and departmental oversight. Pending that review, your access to this facility is revoked." He held out his hand. She unclipped her badge. It was the same motion she had performed 11 years ago, standing in the cold outside a forward operating base in Kandahar province, handing over her kit card when her unit rotated out. The sensation was identical. The small piece of plastic, the enormous weight of everything it stood for. She placed it in his hand. He took it without looking at her and walked back toward the administrative wing. Gilles watched her from across the hallway. She couldn't read his expression. She was too tired, and the overhead lights were too white, and the smell of betadine was very strong. She went to the staff room. She put on her civilian jacket. Wool. Dark green. The lining partially separated from the collar, but she kept meaning to fix it. She put her stethoscope in the outer pocket of her bag. She sat on the bench in front of her locker for 30 seconds, with her hands on her knees, looking at the floor. She was not going to let herself do what her chest wanted to do. She stood up. She walked back out to the floor. Terrence was in the corridor near Bay 4. He'd been asked to wait outside while Gilles wrapped up the secondary pressure dressing. He was standing with his arms slightly away from his body, the posture of someone who doesn't know what to do with his hands when they're not holding something that needs to be held. He looked at her bag, at her jacket, at the blank space on her chest where the badge had been. He said quietly, "They fired you, suspended," she said. "But yes, effectively." He said nothing for a moment. Then, "Dex?" Gilles looked out from the bay. "He's stable. Pressure held. You need to get him to the vet on 17th, now, not in an hour. Tell them exactly what was used." "Here," he held out a folded piece of paper. "I wrote it down." Tara looked at Gilles. He didn't say anything. He went back into the bay. Terrence said, "I didn't know this would. I should have thought." "You needed help," Tara said. "That's what emergency departments are for." It was the wrong thing to say in the technical sense, and she knew it. It was also exactly true, and she was too depleted to offer anything else. She walked to the exit. The automatic doors opened onto the ambulance bay, and the cold hit her like a wall. That specific Calgary cold that carries the Rocky Mountains in it, clean and brutal and utterly without apology. She stood on the concrete apron and breathed it in and tried to think about what came next. Her car payment was due on the 15th. The parking pass for the hospital lot renewed monthly, and she was not sure it would renew now. She thought about calling her sister in Lethbridge, and then decided against it immediately, because her sister would say something practical, and Tara didn't have the capacity for practical right now. She was deciding whether to walk to the LRT or call a cab when the sound reached her. It wasn't loud. It was the sound of multiple vehicles stopping in close coordination. The particular silence after engines cut out. The sound of doors opening and closing with the brisk efficiency of people who have a destination and a purpose. She turned. 3 trucks, not new, working trucks, the kind with equipment straps in the beds and extra aerial antennas mounted on the cabs. Dark green and gray. They had pulled into the ambulance bay with enough authority that the one actual ambulance idling at the far end had moved without being asked. The men who got out didn't rush, 8 of them. She counted automatically, positioning, spacing, the way you count when you've spent time in places where numbers matter. They were in civilian clothes, more or less. Jeans, heavy canvas jackets, boots that had seen actual mud rather than the decorative variety. One had a toque with a maple leaf on it. One was on a phone. Their ages ranged from maybe 30 to late 50s, and they moved with the relaxed precision of people who train together regularly and haven't had to stop. The one in front was a woman. She was perhaps 45, compact and direct in her movements, with dark close-cropped hair going gray at the temples, and a scar running from her left ear to the edge of her jaw. Surgical, Tara noted automatically, not traumatic. Reconstructive work, sometime in the last 10 years. She was wearing a plain black jacket over what appeared to be a fleece pullover, with a patch on the left chest that Tara couldn't read from this distance. The woman scanned the ambulance bay and found Tara immediately. The kind of scan that takes 1 second and arrives with certainty. She walked straight to her. "Becker?" The woman said it like a name she'd confirmed in advance. Tara said yes. The woman's name was Chief Petty Officer Claudette Harros, retired, she said, though she said retired the way some people say between jobs. JTF2, she added, which told Tara everything it needed to. Joint Task Force 2 was Canada's Tier 1 Special Operations Unit. They didn't appear on regimental lists. They didn't talk to journalists. They occasionally materialized in hospital ambulance bays in Calgary on Wednesday nights in February, apparently. Harrow said, "Terrence Auger called my CO 40 minutes ago. We were in Red Deer for a training exercise." She looked at Tara's bag, her jacket, the empty badge holder. "They suspended you." It came out without inflection. Not a question, not an expression of surprise. Just the status confirmed. Yes. Harrows nodded once. "Come inside." It wasn't a request. It also wasn't aggressive. It was simply the expectation of a person accustomed to being followed, delivered without the need for elaboration. Tara followed. The 8 of them came through the ambulance bay doors with the kind of collective presence that changes the physics of a room. Not loud, not chaotic. Quiet and very large. The duty nurse at the bay entrance, a second year named Lizzie, who Tara liked, took one look and retreated 3 steps without meaning to. The security guard at the interior door, whose name was Wojtek, and who had once cheerfully told Tara he'd been a police officer in Warsaw before immigrating, assessed the situation with professional speed, and then stood very still and did not reach for anything. Harrows moved through the department like she had a floor plan memorized. She probably did. Dr. Aldous was in the corridor outside his office, speaking to an administrator Tara didn't recognize. He turned at the sound of the boots on the floor. He took in the group. His face did a rapid sequence of expressions: confusion, assessment, irritation, and then something closer to alarm, although he controlled it quickly. He said, with the particular tone of a man who runs rooms and knows it, "This is a restricted area. You cannot." Chief Petty Officer Harrow stopped in front of him. She was perhaps 5'4". Aldous had 6 inches on her. This did not appear to register as relevant to either of them. She said, "You suspended Becker. I'm sorry. Who are?" She showed him a card. Not a business card, a federal identification card. The kind with the maple leaf rendered in the specific gold tone that belongs to government documents. Aldous looked at it. He looked at her. He looked at the 7 people standing behind her. His throat moved. Harrow said, "Dex is a formerly retired RCMP service animal. He holds an official commendation from the Commissioner's Office for operational service. He was injured this evening in a traffic incident while in the care of his handler, a decorated Canadian Forces veteran with 3 operational deployments. Nurse Becker provided emergency stabilization that prevented the dog from going into irreversible hypovolemic shock in the time it would have taken to reach an appropriate facility." She said all of this without raising her voice or breaking eye contact. What she did was within the scope of emergency first response under the Canadian Forces Medical Assistant Field Protocols, which she is still credentialed to apply. The ADA equivalency under Canadian Federal Service Animal legislation covers medical treatment of a retired service animal in emergency circumstances. She paused, then said, "She was right. You were wrong. Give her badge back." Aldous had gone very still. The color in his face had moved through red and arrived at something closer to gray. He was calculating. Tara could see it. He was running numbers, liability versus liability, exposure versus exposure. The PR mathematics of what a story like this would look like distributed across the news cycle, across the hospital donor list, across the board of governors who had been looking for a reason to review his departmental budget for the last fiscal year. The man with the phone, one of Haros's people, held it up slightly. He wasn't filming, he was just holding it. The gesture was enough. "This is a matter for formal HR review," Aldous said. His voice had lost its register. "I can't simply." Haros said, 45 seconds. "I beg your pardon. You have 45 seconds to make a decision. After that, I make some calls of my own." Her voice was entirely pleasant. That was the most unsettling part. She sounded like someone discussing a scheduling conflict. Aldous looked at Tara. It was not the look of a man who had changed his mind. It was the look of a man who had been checkmated and was deciding how to record the loss. He reached into the inside pocket of his blazer. He produced the badge. He held it out. He did not walk to her. He stood where he was and held it out at arm's length and waited for her to come to him, which was the one small piece of ground he had left. Tara crossed to him. She took the badge. The plastic edge pressed into her palm. "The suspension," Aldous said, without looking at her face, "is rescinded pending departmental review. You're back on shift." She clipped the badge back onto her lanyard. It sat exactly where it had sat for 3 years, the small photo slightly faded, the laminate corner starting to peel. The weight of it was nothing. The weight of it was enormous. Aldous turned and walked back into his office. He did not close the door loudly. He closed it very quietly, which was somehow worse. Haros turned to look at Tara. Up close, the scar along her jaw had the faint shimmer of old skin graft, expertly done. Her eyes were dark and direct and held the particular stillness of a person who has learned to metabolize danger at rest. "Auger got Dex to the clinic on 17th, she said. "Vet called it a grade 3 popliteal laceration, said the pack and the pressure cuff were textbook." She paused for a fraction of a second. "Said if whoever did it had waited another 20 minutes, the leg couldn't have been saved." Tara absorbed this. "He's going to make it?" she asked. Haros said, "He's going to make it." The group behind her had already begun to shift, moving back toward the ambulance bay exit, with the easy coordination of people returning from a task completed to standard. No celebration, no commentary, just the next thing. Haros turned to follow them. Then she paused. "We pulled your file, Becker, from when you were with the forces." She said it without apology. "Your TCC instructor cert, the Afghanistan rotation, the commendation from the Op Attention mission in Kabul." Tara said nothing. Haros looked at her for one more moment. Then she said, simply, "You haven't changed." She walked out. The automatic doors opened and the cold came in. And then the doors closed and the ambulance bay was quiet again. Just the idling truck at the far end and the yellow lights on the slick, wet concrete and the faint sound of a radio from somewhere inside. Tara stood in the corridor. Gilles was at the nursing station. He was doing paperwork or performing the act of doing paperwork. His reading glasses pushed up onto his forehead. He didn't look up. But after a moment he said, in French, something that roughly translated to, "The supply cart in Bay 2 needs restocking." It was the least ceremonial thing he could have said. It was also exactly what she needed. She picked up the clipboard from the hook near the station. She found a fresh pair of gloves in the dispenser on the wall. Bay 2 smelled like saline and the cold that still clung to the air from all the doors that had opened tonight. The cold that came from the river, from the mountains, from the specific February dark that pressed against every window in Calgary like something that intended to stay. She started with the suture supplies. She worked her way through the cart with the focused, methodical attention of someone relearning the exact dimensions of a task they had almost lost. Her back ached. Her knee was stiffening in the cold air. Somewhere down the corridor, the triage line was moving again. A monitor beeped twice and settled. Someone's family had arrived. She could hear the particular quality of voices that come with relief, the way people get louder when the fear begins to let go. Gilles called from the station. Becker. Chest pain in Bay 1. 63-year-old male, possible ACS. Cardio is 12 minutes out. She stripped the gloves off, grabbed a fresh pair, pulled the curtain to Bay 1. She went back to work.